Dr. Patel, I would like to talk to you about gum disease. It's also known as periodontal disease, gingivitis, stuff like that. But here's what I would like to talk to you about it. Almost every dentist, when a patient has gum disease, he will point out to the dentist that within a year or 5 years or whatever it is, nobody knows how fast things progress with a particular patient, he will eventually lose all or most of his teeth. And that is a very expensive thing to replace them and blah, blah, blah. And while this is true, it looks to me that the effect of a gum disease, which is an infection in the gums, which is that yellow, reddish, ugly pus, which, you know, if you cut yourself and you get all infected and it gets all ugly, that is in the gums, which is the gateway to the blood vessels. Nothing goes faster to the blood vessels than right around the gums area, which is open. That's why they're so red. So boom, you know, it goes right into it. So you have that infection going all through your body, down to your liver, to the brain, to the heart, everywhere. It has apparently proven to have premature babies, underweight babies. In fact, in California, there are even dead babies found, stillborn babies. Diabetes seems to be affected by it. The whole immune system seems to be affected, meaning lowered, and the smallest little wind gets the guy a flu and a cold and all that stuff. It seems to be very, very bad. It makes sense to me, and thus to me it looks like that the effect of the gum disease on the rest of the body is far, far worse than the effect of losing the teeth, which in itself is, of course, a host of problems too, and lots of money down the road. But what is your take on what I just said?
It's funny, Helmut, you bring this up. Periodontal disease, we will see in a lot of patients. They will come in, and when you walk into the room, you can smell it. I don't know how they stand, how their wives and their friends stand that. When we look in the mouth, there's pus coming out, or when we just touch a gum, there's a lot of bleeding. The first thing I say to these patients is, if you went to the bathroom and you peed blood, would you be sitting in my chair or would you be running to ER? We need to do something about this gum disease. Gum disease causes a lot of other problems. You know, it causes your blood pressure. It causes plaque in your arteries. It exacerbates your diabetes. Your white cell counts are always higher now because you've got this chronic condition in your gums. And since you have this chronic condition, your systems, your warriors, your white cells are constantly fighting this battle. They don't have time to fight other things. So then you're constantly tired. You're never energized. You never want to do anything. It's all down to your gum disease. We need to do something about your gum disease in order to improve your life. If you don't do anything about it, as a consequence, of course you lose your teeth. But in the meantime, you're losing your life. You're losing your health. You're losing your family. You're losing your friends. They don't want to come near you. It smells. Don't you see that? So
Okay.
We should treat you. And our hygienists are so well trained, and it's so easy nowadays to take care of gum disease and maintain it.
Right, I've heard that the gum disease treatment isn't as bloody anymore. It doesn't take 2-3 days of hurting and all that type of stuff. And on top of it, you know, we're talking this. What you just said doesn't go on when it is super, super bad. Like you said, people come in and you just press the gums and the blood comes all over the place. That's already quite an advanced stage. There are much lesser advanced stages, but the infection is still there, and it's still that yellow, ugly, reddish pus.
Anytime.
It still goes into the body. It goes in. Let me ask you, does it go into the body in two ways? One way is, obviously, there it is. It's in the blood vessels, and it goes right into. Another one is you take a nice steak, you chew on it, you mix it up with the pus, and it goes right into the stomach and spreads from there too. Oh, what a beautiful thought of that. Yeah, right.
Anytime you have even the slightest bleeding from your gums, you have gum disease. You brush your teeth and you have bleeding. The first thing you want to think about is, why am I bleeding? You don't take notice of it, but if you bled from anywhere else, you would run to ER, right? So why is it that you're not paying attention to the bleeding from the gums? We need to take care of that. That's the first thing you want to do, is make sure that you have no type of inflammation in your body. And you start with the gums because that is very noticeable.
Right, it's good. It's
And
interesting that you said if you would bleed anywhere else. Like if a person would have a small, let's say like a dime, a penny. If he would have an infection, a skin problem on his skin, and more than a week or two, he would probably go to a dermatologist, as he should. Um, but in the gum, he has people tell me that a decent gum disease, almost as big as a whole hand, he has this huge infection and he does not want to fix it.
right. And most of the time it's because of ignorance. They do not understand the significance of what they have.
Or
They have,
maybe it's the
and sometimes they just chew gum and they use
Mm.
mouthwash, and nobody tells them that their breath smells.
Well,
And
maybe it's the dentist's fault. Maybe the dentist says, "Hey, you're gonna in 5 years or so, give or take, lose your teeth," and the patient goes, "Okay, I have time 5 years." Just like in this
well, the
current,
significant, yeah,
yeah,
yes, but the significant thing is not losing your teeth, is you losing your health,
right.
is affecting your general health. And that's why we need to take care of it. And it's a sorry state when you're not educated enough by the person that you've seen before.
But
This
maybe
is an
my
easy.
point is maybe the average dentist isn't quite as insisting and graphic about making sure the patient knows that yes, 5 years down the road you're going to lose your teeth, but right now you're ruining your body. Let me ask you this: have you noticed that in the medical field, actually in the surgery field, the people who do hip replacement and the people who do knee surgery, or for that much a tonsil operation or a Band-Aid operation, that those surgeons, not the surgeons who take out bullets in the emergency room from people who just have been loaded with lead, but that they, before they do a surgery, more and more over the last few years, will demand a clean bill of health from the dentist. And they're not concerned about crooked teeth. They're not concerned about a cavity or two. They're concerned about gum disease because they have learned that if there's a gum disease, their surgery in the knee could fail because the infection travels there, or that the body in general is so weakened that if he does his surgery, the body just simply might die or at least get major complications. Have you
No,
seen that
no,
happening more and more?
no orthopedic surgeon will ever replace any hips or knees or do any type of orthopedic surgery. No heart surgeon will touch a patient without having a clearance for that the patient has no gum disease. And that is exactly why they are concerned, because the bacteria get into your blood system, affect these organs, and affect them tremendously. And therefore everybody is now much more aware of gum disease, and therefore it's very, very important to take care of your gum disease, whether you have just slight bleeding or a lot of pus. Both
Right.
conditions can be taken care of very simply in our hygiene department.
So if surgeons don't want to touch you when you have gum disease, because in the old days when I was young, it was more like they looked for a lung infection. They looked for any type of infection. They didn't really look for gum infections yet. But that's kind of relatively recent that they say, ooh, a gum infection is like a lung infection. It just simply kills the body off just from a different part. But so the patients out there should really realize, I think, that if surgeons don't want to touch your body because it could inhibit, then look, not everything has to be so super drastic. Like in the university in Japan, they found out that persons who have gum disease and who have the HIV virus, which doesn't mean they have AIDS, just the virus, but that the virus turns into AIDS much faster if they have gum disease. Why? Immune system lowered. Not every case is that strong. Not everybody has the HIV virus, thanks God. But if it does so drastic bad things, like premature babies, like stillborn babies, why don't we do it just to have a better immune system for the next flu season? I mean, wouldn't that make a lot of sense?
Of course, controlling gum disease is extremely important for your general health, and then that is what patients fail to understand. And it's very, very important to understand that if you do have any bleeding, if you do have bad breath, if you have any kind of bad taste coming from your teeth, you really need to come in and get your hygiene done and control your gum disease. It will improve your energy. It will improve your ability to fight the flu virus or normal cold viruses. It will improve a lot of things in your life. And controlling gum disease cannot be stressed more.
Beautiful. Well, thank you very, very much for letting us know about it, candid and straightforward. I'm sure that will be a help to lots of people out there and make them, fixing their gum disease at the earliest stage that they detect it.
Thank you.
That's just all there's to it. Thank you very much, Dr. Patel.